All public schools in Maryland will be closed.
I've ordered the closing of all schools in the state of South Carolina.
We're going to be closing all public schools across the state.
98.8% of our schools.
Being cut off from their social contacts, that really makes it even harder when you're struggling with any kind of mental health issues.
Since the district switched to remote learning last March, he says they've had 19 students take their own lives.
I think a lot of parents might be sort of surprised at the mental health toll that this whole thing can take on children.
We're here today with Amy Edgar, the founder of the Children's Integrative Center for Success. Amy, I have a slew of questions to ask you today, but I was wondering if you could just tell the world who you are and how you approach pediatric mental health.
Yeah, great, Shawn. I'm so excited to be here and to talk about this with you. I've had a practice in Allentown, Pennsylvania for the last 7 years, and it's integrated care. So we take care of the whole child, including rehab services, physical medicine, and also behavioral health. And as part of our understanding of a child, we've been using genetics and also many other kind of diagnostic evaluations to really understand as close as we can get to root cause so that we know that we're treating the right thing. I'm the mom of someone with autism who's 20 years old now. And we started the practice as, kind of a family mission with the idea that we knew what we wanted for our family. And so we decided to put that together and give it to other families. So Allentown, Pennsylvania for 7 years, nurse practitioner in primary care and behavioral health. And so really practicing full scope, whole human.
Right. You got to treat the whole patient when it comes to mental health. That's really important. So we've all experienced COVID in the last 16 months or so. How's that affected the children you treat and their parents?
I would say in every way imaginable, which is quite a thing to say. I don't say that lightly. In the beginning of shutdown, so last March of 2020, there was a period of time where actually the pressure was off and it felt a little bit like a holiday vacation. And then from there, we started to see this kind of sharp decline. So increase in anxiety, for sure, increase in depression, lots of problems with social isolation. And then as the world moved forward and we still stayed in shutdown, lots of issues with increased demands, parents having to work at home and school their children at home and cover all the bases in, a world that really had changed from, everything from the way you buy groceries to the way you get clothes and new shoes for your kids. So there's been tremendous impact. And we're just starting to see the biggest impact, I predict, this summer and into the fall when kids go back to school.
And so you see the mental health issues from COVID going beyond vaccination and getting the kids in school. And why is that?
Well, so if you think about, children rely on structure to provide a sense of safety and confidence. And so one of the things that has not been available to kids in the last year is reliable structure. So they've sometimes gone to school and sometimes been at home. They weren't sure if it was, how many days a week they were going to go to school or school at home. So there's been a lot of inconsistency in this year. And that has we've seen an impact on their education, on their learning. And so what that means is that, if the system continues to kind of operate on autopilot, the expectation is that kids will just return to school in fall and be fine. And the reality is really different from that. You know, they've suffered tremendous isolation, and many of them have lost family members. Many of them have had family members who were sick with COVID. Many of them have gone through self-quarantine of parents. And so the accumulation of all of those stressors combined with this kind of expectation that they're just going to go back to school in the fall and everything's going to be great. It's kind of like watching a train wreck coming down the tracks.
So in COVID, I imagine you've implemented some new strategies, new programs. What's worked for you and what hasn't worked for you?
Well, we went completely virtual in our care delivery model in March of 2020. And so we have continuously provided service. I'm happy to say we never missed a patient visit. When the state mandated shutdown and quarantines, the stay-at-home orders were implemented, we turned our bricks and mortar practice to completely virtual care in about 3 days. So we were ready for it. We had already been providing virtual care in certain circumstances. And so we were able to very quickly mobilize the team, and we were already set up to deliver it, and we never missed a visit. So I'm very proud of that. You know, some of the things that we've learned along the way are that families really appreciate virtual care. There's a convenience factor that means a lot in terms of not having to drive to the office and take a big chunk of time out of their day or their evening. It also works very well for them in that if they have a sick sibling, if the child has a sick sibling, they don't have to worry about dragging a sick child out of the house. So, and we've worked really hard to deliver virtual care differently. And by that, I mean, you know, you and I are talking, and this is, via Zoom. And I think this is the way in which most people expect a virtual session would go as far as, you know, our care is concerned. And in fact, it doesn't look anything like this. So we've set up virtual spaces, virtual rooms. Therapists and kids have created their own virtual rooms. We've incorporated all kinds of digital therapeutics and worked really hard in the last year to deliver the same quality and standard of care as we would provide in the office.
And do you think this, after, you know, life gets back to normal contact, do you think this is going to stick and last?
Well, for us, we are now a virtual care company leading with virtual care. And so it will be the exception for somebody to come into the office versus receive care virtually. We have had many conversations with our families and have, you know, made that pivot permanent based on that feedback, based on their input. So I don't see it changing. One of the things that will change for the better for us is when kids don't have school and after school activities and therapy sessions online. We won't be competing with all of that. So right. We're going to do really well.
Amy, we understand you are passionate about integrative care and autism, obviously with your daughter. And you have this, your new care delivery model. So tell us what the success model really is.
The success model is conceptually kind of at a high level, really about understanding a child or a human as with as much data, clinical data as we can before we recommend an intervention. Success is an acronym for all of the areas that we address when we agree to work with a family and to help care for a child. And so all of the theoretical kind of thinking about what we do is found in success. So it's really joining with families, collaborating, creating a shared sense of understanding, The medical interventions are not the only thing that we consider. So we really are looking at all possible interventions. And really the family and the child define what success means. So we're not telling them what's success, they define it, and then we help them get there. So it's conceptually, it's the idea that we do our best work when we are informing and assisting and guiding families and children to success.
So you're an advisory board member of the Digital Therapeutics Alliance, right?
Yes, I'm on the clinical advisory group.
And what's the role of technology in your success model?
So we're very tech forward, and the idea is that we want to take 21st and 22nd century science and bring it to people now. And what that means is that, we're looking forward and broadly looking forward for evidence-based interventions, therapeutics, diagnostics that use all of the explosion of science and technology of the last 20 years. We want to get that to people and have people have access to be able to use it now. We operate under a hashtag, we are not waiting. That's kind of our motto, our mantra. And so as a result of that, we are the core group on our team. We are always kind of scouring what's going on in science and technology and looking to add it to our bag of tricks, our set of diagnostics and interventions that we're currently using.
So what do you think the future is for behavioral health technologies?
Well, I think you can see the future now in a lot of the technologies that are currently advertising on TV and, developing behind the scenes. And so a lot of it is based on pretty solid evidence from cognitive behavioral therapy interventions and science. And while I support it completely, that is not the be all and end all. There are also digital therapeutics that are coming or already available that are actually looking to change physiology. So I think it's really the combination we're going to see over the next 20 years, the combination of physiologically based interventions, digital therapeutics, and behavioral digital therapeutics come together in a really powerful way. And as we learn what is successful or not successful, or we're able to combine therapeutics and look for synergistic effects, as we learn, we're just going to get better. It's going to get better and better. So you can kind of see what's happening now. And I've had the benefit in my clinical lifetime of living this. It's really been amazing to see where we were even 15 years ago and where we are now, and think about where we'll be 20 years from now. It's kind of mind blowing.
You talked about precision in that success story, precision care. Tell us what the role of pharmacogenetics has in mental health care.
We use pharmacogenomics on the front end when we are doing, I guess it translates to a workup, a medical workup on a child. And pharmacogenomics for us is as much about understanding the child as it is about medicine. So I recommend, and we use pharmacogenomics as part of our diagnostics to understand, and I recommend it to all of our patients. From there, we take the data from the test and can make decisions about things like diet and exercise and supplements and all kinds of interventions that are above and beyond or outside of medications. So that is the role for us in terms of precision work that we're doing. We're looking for a target and an intervention to hit it. And that information really gives us great targets sometimes.
Great. So tell us why you use Genomind for that service.
Sure, yeah. So I use Genomind because I am committed to the best science, the best evidence, and the best product for my families. And so over time, I have I looked around before I opened the practice and asked the question, who's doing pharmacogenomics and who's doing it best right now? And Genomind was really out in the forefront in terms of what I was looking for. Over time, I've gone back and asked that question. In all fairness, I am a patient advocate, and my job is to deliver the best to my families. So across time, I've gone back and asked the question, is it still the best? Is it still, the right tool? Are you guys, or was Genomind making progress across time as the science continued to evolve? And the answer has always been yes. So every time I ask the question, who's doing the best pharmacogenomics out there? The answer so far, the answer has been Genomind, and I expect that to continue.
So could you give us more details of the Genomind tests and how it's applied to the patient and how you work it into your workflow?
I absolutely can. And it's fun to talk about this from a developmental perspective, where we were and where we are now. So when we first started, we would get, we had packages, and there was almost like a test tube with a big well. And my job was basically to coach little kids how to spit into the well. So we joked and said we were excellent coachers of, spit into this. That was way back in the beginning. And so much has changed since then. So we went from having to submit that much saliva and this kind of convoluted collection process to something that's really easy now. So I prepared and thought maybe you'd want to see. So I brought a Genomind kit from the office. And so it comes in, it's kind of like a transport envelope, like a FedEx package. And inside is very simple. It's an envelope. And so if I'm talking about spitting into a well, this much saliva, and now it's 2 Q-tips, you rub it inside one cheek, the other, and even better, you put it back into the paper. This is one of my favorite things about this. So there's no complex collection system. It's easy for families, and it takes literally 3 minutes to go through the whole thing start to finish. It's easy too, because I can play a game with children and, make it fun, and they laugh about it, and we're finished. And then if we're shipping from the office, we just put it back in the envelope, send it on its way. And in a remarkable pivot or sign of the times, Genomind, you guys, at the point of shutdown, lockdown for most people, you guys were able to seamlessly bridge that for us by direct ship to patients. So in our virtual care model, this is really important. So instead of you sending it to me bringing the patient in, me sending it back to you, you just directly ship to the patient. And that's been incredibly convenient.
And how quick do you get the information? Where's the information flow to you?
Yeah, it comes right back through the clinician portal, and the average turnaround time, I would say, is 3 days, and maybe 7. But that was one of the things that was really surprising to families. I would say, we're going to take this, I'll send it out. It turns around usually in 7 to 10 days, sometimes at 3. Depending on the lab, and they're shocked. They think genetic testing is going to take months and months and months, and they're going to have to wait. So it turns around very quickly.
So you mentioned earlier, Amy, about precision, data, measurement, science driving it. So what is it about measuring outcomes and data, and how do you incorporate that in your practice, and what tools do you use to actually achieve that outcome?
So when we talk about data collection on the front end, when we first meet a family and child, we collect about 16,000 discrete variables of data, and that includes genetics testing, so pharmacogenomics, but also microarray and exome sequencing if it's indicated. We also integrate cognitive testing, collecting all variables in standard achievement and intelligence testing. looking at things like working memory processing speed, auditory and visual processing, all the things that go into explaining human outputs, human behavior. Also in medical exams, we're looking at all of the constitutional factors that might influence, so things like lead levels or exposure to things like Lyme disease. In this part of the country in Pennsylvania, it's endemic. And so we really look at everything as closely as possible. When you do that, you really start to see alignment with variables in a particular direction. So I can take phenotypic data that we're assessing on the front end. So lifestyle, diet, family issues and dynamics, constitutional health. I can put that with the genetic information, and it really creates this kind of powerful, I think of it as a stacking effect. Wow, this gene says this should be happening. Look, it's happening here, here, and here. Then that becomes a high value target for intervention. And so then we ask the question, what is the what intervention is most likely to deliver success for this child? And that takes into consideration family resources, the school setting, all kinds of other variables. We pick an intervention or we pick several. The family decides what they want to do with that, and then we put the treatment plan together and get going. So that's a kind of a general answer to your question. We're measuring data every step along the way. At the beginning, the first initial part of treatment, we use pretty standard measures, and then moving in the direction of more tailored care, more precise care, we start getting a little bit tighter with the measures that we're using.
Well, it's clear that you take a very, very comprehensive approach to treating your children and really care about it. And so I'm really curious, when you're using the Genomind pharmacogenetic test, and that's part of your core information that you're putting together, what's preventing other care providers from doing pharmacogenetic testing for children or adults?
So in my travels, I have been talking about our care delivery model for the last 6 or 7 years. And in my travels in those conversations, I think that there's been concern about the newness of the science, even though that's a myth. There are concerns about what if I don't, genetics seems like this really kind of overwhelming field of science that, people feel inadequate or they have less confidence about knowing how to work with the information. So sense of inadequacy on the part of providers, like, do I have to go learn genetics too? Sometimes that makes it challenging. And it's not, my answer to that is always, you have a consultative team at your fingertips. You don't need to learn everything about genetics. Use the resource that is being offered. I think also there's a lack of awareness in terms of the utility. And I think that really there's a tendency in our culture to kind of, the status quo is okay. And if it's not broke, if it's working okay, I don't need to fix it. And so it's inertia. It's all these factors that really seem to support the lack of adoption. I think it'll be standard of care in 5 years. As I'm watching the science evolve and explode, it's soon going to be negligent to prescribe medicine without it, certain kinds of medicine without it.
Well, I share that opinion, and hopefully in the future that physicians will be encouraged or reimbursed more for using good precision medicine techniques for mental health.
In addition to the ways that I expect COVID to affect my families in care, I think the broader landscape of healthcare is really in a position to work hard and get it right or really miss the mark. I have a lot of concerns about that. In this last year, a lot of families have had to forego basic primary care, wellness checks, Sometimes, vaccinations have been missed. And, just the kind of basic level of primary care that children typically receive, it's been changed. There hasn't been a lot of that going on this year. Pediatricians, primary care people have tried heroically, and it's still been really challenging. So I think I expect there's going to be a reset period where there's kind of a lot of catching up to do. And that in some ways can, potentially overwhelm providers who are already overwhelmed. I do think that there's going to be there is impact on providers. We have a nation of healthcare providers who have experienced trauma that I would, pose as equal to war, the trauma of active duty in a war. And, that is currently, we're starting to see people leave healthcare jobs, move out of the direct care work and into another area. So that is potentially problematic. And so all of that really points in the direction of digital therapeutics and their significance in the next year, 2 years, 5 years. Because digital therapeutics can extend our reach of care. Digital therapeutics are often mostly not happening in a physician or a provider's office. They're happening in the family's home or at school or, different places. So it really extends our reach as providers out into the lives of the patients. And so that is one of the things that I am really hopeful about in terms of how do we address staffing shortages, physician shortages, nurse shortages as we move out of COVID crisis, and how do we address the kind of burgeoning need for interventions for anxiety and depression and all the things that we're starting to see post-COVID or in a post-COVID time.
Yeah, and I think, Amy, you've highlighted to me, the COVID era has created a fundamental change in how we're going to deliver healthcare going forward. So when you look at what you call remote care or virtual care and augmenting that with digital tools, so you're getting, real-time monitoring of your patients. Mm-hmm. You're getting a much more precise view of what's going on and what needs to be done for the intervention. And it's really evolving in meeting the consumer. Reducing, now we have this gas shortage, not having to drive to your office, all sorts of things. So I agree 100% with you. Coming out of COVID, I think there's been a lot of lessons learned. It's accelerated the digital revolution and accelerated, the need for telemedicine going forward. And we've seen some of these waivers turn into law. So I'm encouraged, like you are, that we're going to see positive change a result of COVID, and things remain sticky going forward with access tools and measurement tools.
Yeah, agreed. I think that the acceleration, I am involved in many different professional organizations, and the acceleration of this time, it's like we lived 10, 15 years in one, in terms of how quickly we adopted and adapted and, were able to move. We just leapfrogged, in my opinion. We just kind of leapfrogged this whole kind of slow moving march towards progress. And I'm grateful. If I think of anything that I can point to as a real silver lining, it's that people are going to have in now and in the future more access to better quality care.
Right.
And that's it, right? That's what we all want.
Well, we're happy we're part of that solution at Genomind, and thanks very much for your time today.
Absolutely. Have a great day, Shawn.
You too.